Assalamu alaikum, I'm Dr. Muhammad Ali Rabani. Let us talk about the dorsum of the foot. So this is the first one will be the overview session, and this session will talk about the surface landmarks, the subcutaneous tissue containing the veins, lymphatics and nerves, and deep fascia. Extensor retina will just go through an overview and the contents will name them, and we will have separate videos in detail for the other structures. So, surface landmarks of the foot will have including the deep malleoli, the medial and lateral one. The medial one will be a little more prominent. Posteriorly, they are extending equally. Anteriorly, the medial one is more forward. Then, roughly here, anterolaterally about 3 centimeter to 3.5 centimeter, roughly here, there will be a tuberosity of the navicular bone. And if you draw a line between these two, and somewhere in the middle, you will be able to find the head of the talus. Then you will be able to palpate the different tendons of the tibialis anterior, extensor hallucis, extensor digitorum, and these will be more prominent when you are doing those movements. For example, if you're extending the toe, you will be very well able to palpate extensor hallucis. If you're extending the digits, you will be able to palpate extensor digitorum longus, and if you're dorsiflex, you will feel tibialis anterior. Then there is a muscle, the extensor digitorum brevis, lying roughly here, visible in lean people but palpable in most of the people. If you place your fingers here and you extend your digits, you will be able to palpate these muscles. And then dorsal spadius artery pulse, it will be palpable against these bones. The navicular bone, the between the two tarsal bones, that will be palpable here, and on the base there will be base of fifth metatarsal, it will be palpable right here on the lateral aspect, and ball of big toe will be technically present on the plantar aspect where the big toe makes a joint with the metatarsal bone. So subcutaneous tissue will have nerves and veins. It is thin and mobile skin, and you can move it right now if you want to. There is a superficial venous plexus in the superficial veins, and containing the most of the veins of the foot from the deep aspect too. And on the medial aspect, it drains into the great saphenous vein. On the lateral aspect, it drains into the small saphenous vein. Keep in mind, the great saphenous passes anterior to the medial malleolus. The small saphenous veins passes posterior to the lateral malleolus, and these landmarks are helping you in to cannulate these veins if a need arise. Then there are lymphatics. It will have a nerve in lymphatic plexus, and it follows the saphenous veins. From the medial aspect and around the big toe, they follows the great saphenous vein all the way to the vertical group of inguinal nodes. From the lateral aspect, it follows the small saphenous vein all the way to the popliteal nodes. Cutaneous innervation, it's complex and it is frequently asked in the examination. For most of the dorsal aspect, as shown in this color, this is by the continuation of the superficial branch of common peroneal nerve, or superficial peroneal or superficial fibular nerve. After exiting on the lower left lateral aspect of calf, it divides into the anterior and posterior branches, and these go on to distribute and supply the dorsal aspect. The slit between the first and second toe, this slit is supplied by the deep branch of common peroneal nerve, the deep peroneal, the deep fibular nerve, and the discussion of the deep fibular nerve has been carried out in the lecture of in the previous lecture in the anterior compartment. Then the medial aspect of the foot all the way to the ball of big toe, uh, this is from the saphenous nerve, is a branch of femoral nerve that supplies the medial aspect of leg, and the lateral margin of the foot, it is supplied by sural nerve that we will discuss in the posterior compartment of the leg. So these are the cutaneous innervation. Contents include the long tendons that we studied in the previous lecture, that is the tibialis anterior, the extensor hallucis, the extensor digitorum and peroneus tertius. There will be small muscle, this is the extensor digitorum brevis, and it somewhat this part, the it was sometimes separated as an individual muscle called extensor hallucis brevis. And then there are nerves and veins, and including dorsal spadius artery and its branches. Then there is anterior deep peroneal nerve and its branches that are present in the foot. And the deep fascia contains this extensor retinaculum. We will having a small lecture on the structure surrounding the ankle. So this is the extensor retinaculum, inferior extensor retinaculum. It's present basically on the dorsum of the foot, attaching to the calcaneus on lateral end and dividing into two parts. The upper one going to the tibia and the lower one going to again palmar aponeurosis. So this is a basic overview of the dorsum of the foot. If you have any questions, suggestion and feedback, do let me know. Thank you so much.